Okay, so now it is time for discussing about diagnosis of Hemophilus influenza. So before going to discuss about this, it is important to understand about what kind of disease they cause and what part of the body are affected by Hemophilus influenza. So I would like to recommend you to go and watch my previous videos on Hemophilus influenza. If you are new in this channel, then it will help you to understand. So now diagnosis can be done by identifying Hemophilus influenza. So we can grow Hemophilus influenza in a culture from biological samples. Okay, and in very first video we have told that Hemophilus influenza can grow in chocolate agar that provides the factor 10 and factor 5 which is necessary for their growth, along with the red blood agar, right? This blood agar contains along with the staphylococcal oral colony, right? So if we grow in such kind of culture from the sample from blood, CSF, pleural fluid, synovial fluid, then fluid from sinus aspiration along with tympanocentesis, tracheal or lung aspiration, bronchoscopy or bronchoalveolar lavage. That means we are taking sample from the infected area of Hemophilus influenzae and then we are growing them in appropriate culture medium. Okay, that can be chocolate agar or that can be blood agar containing staphylococcal oral colony. Okay, then if we get convex, gray, white or transparent colony, then we can conclude that yes, Hemophilus influenzae is present. Okay, that is the biological aspect of diagnosis of Hemophilus influenza. So this is the picture of tympanocentesis. That means suppose remember about this that we have discussed that Hemophilus influenza causes otitis media, which is a infection in middle ear, right? So here we are using a instrument to take a sample from the middle ear and we are growing them in a appropriate medium. That is what tympanocentesis is. Okay, along with bronchoscopy, bronchoalveolar lavage, that is we are taking sample from bronchi, because I have told you that Hemophilus influenza non-typable can cause bronchopneumonia to those people who are already infected or who have suffered with chronic obstructive pulmonary disease, right? So that is the idea. So now, so that is the biological aspect. Okay, we are culturing biological samples in appropriate medium. Okay, and from what type of samples we are taking? We are taking blood, we are taking cerebrospinal fluid, we are taking fluid from sinus aspiration, we are taking pleural fluid, we are taking tracheal or lung aspiration, we are taking bronchoscopy, bronchoalveolar lavage and tympanocentesis sample. Okay, so now serological method. So we can perform latex agglutination, co-agglutination and enzyme immunoassay to detect the antibody against the Hemophilus influenza. Okay, so we have also discussed that epiglottis are also affected by Hemophilus influenza, right? So if we are expecting that epiglottitis has occurred due to the Hemophilus influenza, then we can perform laryngoscopy. Okay, and if we get a view of cherry red salivary epiglottis, then we can conclude that yes, epiglottitis has occurred. Along with, you can also perform a X-ray, which X-ray will show thumbprint like epiglottitis, thumbprint sign on epiglottitis. Okay, so let's see the picture. So this is the laryngoscope. From this laryngoscope we are doing laryngoscopy. So if you get a cherry red salivary epiglottis picture after laryngoscopy, then you can conclude that yes, epiglottitis has occurred. So that is how laryngoscopy is done. And this is the X-ray plate where we are getting thumbprint sign on epiglottis. Okay, so all the picture I have taken from Google. So then the bronchopneumonia. So I have told you that Hemophilus influenza can cause bronchopneumonia. Under such circumstances, you can get bronchial wall thickening. You can observe confluent areas of consolidation. Along with chest X-ray can be done, which gives you a ground glass opacities. Okay, so that is the various kind of diagnosis approach. So we can perform biological technique where we are culturing biological samples, for example blood, cerebrospinal fluid, for example pleural fluid, for example let's say fluid obtained from sinus aspiration, tympanocentesis, tracheal or lung aspiration, bronchoscopy, bronchoalveolar lavage. In serological method, we are using latex agglutination, enzyme agglutination and co-agglutination, and we are finding antibody against the Hemophilus influenza. We can also check for epiglottitis where we are using laryngoscopy, and if we get cherry red shallow in epiglottis, then we can make sure that yes, epiglottitis has occurred. And also we can perform X-ray that will give a thumbprint sign on epiglottis, and also the bronchopneumonia. Okay, so where we can get chest X-ray. Okay, so this chest X-ray will show a ground glass opacities and also bronchial wall thickening and also confluent areas of consolidation. So that is the important diagnosis that you have to remember from Hemophilus influenza. So in the next video we will going to discuss about the treatment of Hemophilus influenza.